My name is Winston Tan. I'm an oncologist, and I have a guest today that we would like to interview. And Deb, could you tell us some more about you as a person and your journey?
My journey with kidney cancer, I'm not sure how long this video will be if I go into great detail. So my name is Deb Maskens. I'm a kidney cancer patient, stage 4. I've been stage 4 for many, many years. I was originally diagnosed at age 14 as a young teenager, and I had a full radical nephrectomy at age 14. Never expected to see kidney cancer come back in my life, but it did come back, unfortunately, when I was 36. And I had 2 children by then, and I remember how really tough that was to get that diagnosis. And I read online that my prognosis was probably not very good, and I started planning my life as if I was going to live maybe a year because I'd had a massive recurrence. So that was 22 years ago.
So along your journey, what was your greatest challenge, and what would you like to share with other kidney cancer patients so that they can be hopefully ask better questions and face the challenges a little easier?
Well, I think the most important lesson I've learned as a patient is to learn as much about your own disease as you possibly can, but also to find the very best doctors who are expert in kidney cancer. And so very quickly in my journey, I had to move away from the most convenient location, close to home, and to travel a little further for me so that I could see kidney cancer experts who really understood this disease. And that was the first time when I actually heard the words hope. Because nobody had very much hope for me when I was 36. They said, this is stage 4 kidney cancer, it doesn't look good. But when I found the right expert in kidney cancer, he had every reason for hope. And so I have continued to be hopeful and to do what I've needed to do, but I owe that, and I owe my survivorship to the expert doctors who have taken care of me.
Besides trying to empower yourself and equip yourself as a patient, what do you think your advice would be for other kidney cancer patients?
Boy, I can't recommend enough talking to other kidney cancer patients. There's an incredible network out there of survivors with kidney cancer. We have different opinions about different things, but boy, we have educated ourselves, and I think we welcome new patients to the online community and will help answer the questions and can really walk patients through some of the questions that they might want to ask without necessarily offering the medical advice, but helping patients navigate, because it's awfully frightening at first. And I think there's tremendous power in the patient community. And we have a number of long-time survivors. Somebody recently posted, how many of you are out there who were diagnosed before 2010? And all of these responses came in, and you could just feel the levels of hope that people were feeling. That some of us, I've been metastatic for 22 years, and I'm still here, and I'm not here and suffering. I'm here and living well.
So how do you define living well as a kidney cancer survivor, and how should we define that, and what have you heard through different support groups about survivorships in kidney cancer?
You may be surprised to think that I define living well by staying away from my cancer clinic for as long as I can stay away. So I follow the guidelines, but I don't want my life to be built around my medical appointments. And so I have those, and I have to deal with my disease on those days. But what's really, really important to me is my quality of life, my family, my ability to exercise and volunteer, and just not letting the kidney cancer become the most dominant thing in my life, because there is so much more to living, and I guard my quality of life as a precious gift, And before I take a drug or drug therapy or even a surgical option, that if that might damage my quality of life, I'm really going to question that before I do that, and really weigh up the pros and the cons for me, so that I can continue to live this life, because I don't want to be living a diminished quality of life. So that means sometimes my oncologist might recommend something, and I say, thank you for your opinion, and I'll come back another time when I've thought that through.
What do you think would be the role of support group, and what are opportunities for a patient being part of a support group? Who are the patients that ideally would be helped by a support group based on your experience and your advocacy for your organization? Please tell us more about that.
Well, it's funny that some people, they hear the word support group, and we tend not to use that phrase. We talk about patient organizations, because a support group kind of implies that we sit in a circle, we hold hands, and we complain about our awful conditions. And that really doesn't help anybody very much. So we talk about patient information, education, and empowerment. And that's a much more positive thing to do. And yes, we do peer support, and we help people through those rough moments. But it's not just about, talking and complaining. It's really about how can we play an active role, and how can we make things better for other patients. I think about the difficulty that I had in making some treatment choices. If I can help another patient and pay it forward, I think that's what this movement is about. And the Judy Nicholson Foundation is truly about supporting other patients. And there are no ulterior motives. It's just simply about helping patients, helping their caregivers, and helping people get through those crisis moments so that you can go on and live life and live it well.
Thank you. How important are second opinions? You mentioned about second opinions earlier, and how should patients deal with some physicians who actually get offended by you mentioning about second opinions? So tell us about challenges and how you can overcome this challenge as a patient.
Wow, that was a controversial question. So, should every patient get a second opinion? I would say probably not. It depends how good the first opinion was. And so the key questions I would think for a patient is to find out, how much kidney cancer does your doctor treat? How expert are they in their field? And volume matters. So if your physician treats hundreds of kidney cancer patients, if they operate on hundreds, if they medically treat, and if you have a rare subtype, how many other patients with that rare subtype are being treated there? And maybe you found the best center in your first opinion, so maybe you don't need a second opinion. But I do find patients, and especially, I'm a Canadian, we don't like to offend people. And so they're so reluctant because they don't want to offend their doctor. And my message is, go right ahead and offend them. Because the last thing you want is a tombstone that says, at least I didn't offend my doctor. This is your life, and your life may depend upon that second opinion. In my case, the first, the second, the third opinions didn't give me very much hope when I was 36. The fourth opinion said, I want to operate on you, and I think we might even achieve a cure. That was magic.
Thank you. We would like to thank Deb Maskens here. She talked about her journey as a kidney cancer patient, in fact, a stage 4 metastatic patient. She defined quality of life for us, defined the different challenges that patients with metastatic disease would have, how support group would help certain patients, or gathering together, helping each other, equipping each other, empowering each other, and in addition to that, the value or disvalue of second opinion. Thank you for joining us at Judy Nicholson Foundation. Hopefully, you'll listen to more videos in the future. Have a good day.